Good evening, everyone. Behalf of the five students, young doctors from South Asia, I am welcoming you everyone to you for the webinar on the commemorate the World Day of Safety and Health at Work. To start, actually we have three speakers from the region, and also we have the introduction. Then we'll go with the speaker and panel discussion. After that, we'll have a question and answer session. So to start, I'll welcome our regional chair, Dr. Sign up to give a welcome talk.
Thank you, Gobe. Thank you. Hello, everyone. Welcome all the participants and all the people who have made it today and who have joined us for the session today. So as a World Day for Safety and Health at Work is celebrated worldwide on the 28th of April. And this day, basically, it draws attention towards promoting a very safe and healthy work environment for all the employees that are working all around the world, right? So, this time around, Gopit has also mentioned that WONCA also thought of commemorating this day and reaffirming the concept and reaffirming the idea that safety and health at work for all the employees and all the people is very, very important. And WONCA has also reassured that family doctors are they also play a very crucial role in ensuring that these safety parameters and the promotion of health and safety at workplaces should be a top priority for all the family doctors also. And for that, I welcome all the esteemed speakers who have joined us today, Dr. Fauzia, Dr. Asitha, and Dr. Supritha, who will be presenting on this topic and who will be throwing light on this important issue. Thank you also the Spice 2 team, Sri Lanka and Gobit, for organizing this event and hosting it. It's a regional event from all of us, but the team Sri Lanka has been in charge of arranging the webinar for today and has done a wonderful job. So very well done by Gobit and all the team of Spice 2 team Sri Lanka. And then let's just go ahead and move ahead with the webinar. So I welcome all the speakers and all the participants from all around the region for the session today. Thank you.
Thank you, Sign up for the great introduction and welcome speech. And I'll invite the Dr. Shane, our committee member from the Spice Road, Sri Lanka, to give an introduction presentation.
Hello, everybody. Can you hear me?
Yes.
Yes.
Yes. Hello. Good evening, everyone. My name is Shane. I'm a general practitioner from Sri Lanka, and on behalf of the Spice Route, I would like to introduce to you this topic, World Day for Safety and Health at Work. So April 28th is named as the World Safety Day. So let me tell you why. So basically, a safe and healthy working environment is a fundamental principle as well as a fundamental right for all workers. So, with that in mind, the International Labour Conference in June 2022 identified that a safe and healthy working environment is as a framework of the fundamental principles and rights at work. And so this is a culmination of what happened back in 2003, where the International Labour Organization began to observe this day in order to stress the prevention of accidents and diseases at work. So, basically to raise awareness of the importance of safety in order to prevent accidents, diseases, and injuries which are happening at work. So our task as general practitioners, as family physicians today, is simple, but it's a daunting task. But what we have to do is the prevention of occupational accidents and diseases by raising awareness. And so in that background, there are certain emerging risks for the in occupational health. For example, there are newer technologies and production processes coming up. It could be nanotechnology, maybe it could be biotechnology, and as well as there are radioactive hazards, and there could be chemical hazards, and not only that, even we have identified psychosocial hazard, even the psychosocial environment impact of the occupational background, as well as there could be emerging ergonomic risks, as well as emerging physical risks. So with the consumerism and industrialization, it had led to newer working conditions and also higher workloads, where because of this, the manufacturers are eager and enthusiastic in only to raise the production, but not considering the human aspect of the workers. So and another issue is the emerging forms of employment, such as a lot of people, especially in the South Asian countries and developing countries, they are resorting to self-employment and also outsourcing, and also temporary contracts. So considering that fact, in many occasions, a lot of employers do not consider the safety of the employees, and do not consider the safety protocols, or they do not invest on safety measures and safe protective personal protective equipment. So therefore, today on April 28th, being the World Safety Day, as general practitioners, it is our task to raise the awareness, as well as to urge the government to look into the safety of the workers. So in the near future, now in May 1st, the May Day being the World Day for the Workers. So this is a very timely occasion to raise the awareness on safety of the working, all the working people. And so this is my final slide. This is Master Oogway from the very popular cartoon series Kung Fu Panda. Master Oogway says, there are no accidents and everything happens basically reason. So if we actually identify if there is a risk, we can prevent it. And nothing happens just by accident. Everything happens because we do not take measures to stop the emerging risk. And so being the World Safety Day, today we have three eminent speakers to talk to us about the role of the family physician and implementation of safety and health at work. And let me, in that background, hand over to Dr. Gobit to proceed with the webinar. Thank you very much.
Okay. Thank you, Shane, for the great introduction. So you have given the way why you are celebrating and all. Then, so I will hand over to the Dr. Shamin, our National Secretary, Spice Group Sri Lanka, to introduce the speaker and then continue the webinar. Thank you.
Thank you, Dr. Gobit. And Shane, that was very interesting. We definitely play a pivotal role in increasing awareness for safety at work. So it's my pleasure to introduce our guest speaker. Our first speaker for today is Dr. Supritha, came all the way from India. So Dr. Supritha has completed her MD and she has postgraduate diploma in geriatric medicine, and she's also trained in emergency medicine. And she has served both in rural and urban medical setups. I would kindly invite Dr. Supritha to start her presentation.
Thank you. Thank you for that introduction. Can I share my screen? Should I share my
Yes,
screen?
sure.
Yes,
Yeah,
yes,
you can, yeah.
Able to see it?
Yes, we can see.
Yeah, good evening, everyone, and thank you all for this opportunity to be a speaker in this platform. So today we are celebrating safety and health at work and work. So let's start with a brief background and the introduction for the same. International Labour Organization, along with WHO, in its first summit in 1950, defined occupational health as it should aim at the promotion and maintenance of the highest degree of physical, mental, and social well-being of workers in all occupation. The prevention among the workers of departures from health caused by working condition, the protection of workers in their employment from risk resulting from factors adverse to health, and the placing and maintenance of the worker in an occupational environment adapted to his or her physiological and psychological equipment. So to summarize, we can call it the adaptation of work to the man and of each man to his job. This was mainly this occupational health concept initially started with targeting the mine and the factory worker, but the modern concept of occupational health now embraces all type of employment, commercial enterprises, service trades, forestry, and agriculture. And there's also a new concept which is called ergonomics, which is human engineering. Until I started preparing for this session, I was under the impression ergonomics is mainly applying to the software and the corporate companies where they come with the low back pain or the neck pain or the posture issues and all that. But ergos means work and nomos means law. That is fitting the job to the worker to achieve the best mutual adjustment of man and his work for the improvement of human efficiency and well-being. What are the levels of different applications? What are the different levels which we can prevent any of the occupational hazards or the diseases? One is by health promotion. The next is specific protection and early diagnosis and treatment, and disability limitation and rehabilitation. When we talk of health promotion, it is focusing on the nutrition of the employees, physical activity, and managing the stress level and addressing any psychological issues. Specific protection is immunization against any diseases, and also specific protective equipments as per the work environment. And early diagnosis and treatment, depending on the type of the work or the employment, the possible, as we know, a few of the occupational diseases are pneumoconiosis or even biological hazard related agricultural poisoning and all those things. Disability limitation and rehabilitation is the final stage. What are the different methods or the tools that we apply these preventive methods? One is by epidemiological approach and getting the statistics, doing regular audits and getting the numbers to see where the loose ends and tying those loose ends, and frequent health screening depending on the type of the industry, and regular health education on handling the equipments or the possible industrial hazards as per the industry work industries that they're working. It has grown out of realization that the workers is more important than the machine while he operates. The worker cannot be permitted to endanger his life and limb in an occupation while the employer makes a fortune. So let's see what are the legislation or what are the acts or some schemes which are in place to protect the employees. The first act, the first Factories Act, which started in 1948, but to date back, it started as early as in 1881, and there were regular amendments, and the latest amendment was done in 1987. The Employee State Insurance Act, which was in place since 1948, and other specialized acts, which includes Mines Act, the Plantation Act, the Minimum Wages Act, the Maternity Benefit Act. Rajiv Gandhi Shramik Kalyan Yojana. This comes under Employee State Insurance Act, which was in play, which initiated from the year 2005. It states that in case of any unemployment due to closure of the factories or due to closure of the factories, the employee is eligible to get the minimum wages and payment after fulfilling the certain eligibility criteria. So all the employee acts and the schemes comes under one roof, Ministry of Labor and Employment. At present, there are about 44 labor-related statutes enacted by the central government dealing with minimum wages, accidental and social security benefits, occupational safety and health, conditions of employment, disciplinary action, formation of trade unions, industrial relations. The list of central acts is annexed. There is also, these are all under, this covers the people who are employed under certain industries or the work environment, but there's also schemes which covers welfare of the unorganized sector of workers. So Unorganized Sector Workers Social Security Act, initiated 2008, has been enacted. As per the provision of the Act, a National Social Security Board has been constituted for recommending formulation of social security schemes, life and disability cover, health and maternity benefit, old age protection, and any other benefits as may be determined by the government for unorganized workers. E-Shram for unorganized workers is an online portal to cover about 38 crore workers in our unorganized sector. As per day, there are about 28 crore workers have been registered under the scheme. The Occupational Safety, Health and Working Condition Code 2020. This replaces 13 old Central Labor Acts, including the Factories Act, which was initiated in 1948. The Sexual Harassment of Women at Workplace, also known as POSH, Prevention of Sexual Harassment Act, started in 2013. It focuses on the prevention of any sexual harassment or abuse against a female employee in any sector of the workplace. So these are the few pictures. On the right, it is a awareness and e-registration campaign which was done in Goa for the lifeguards and lifeguards working at the beach. And on the right, you can see a nutritional checkup camp organized for female brick workers and other industrial workers on occasion of International Labour Day. EWG, that is Employment Working Group, G20, which the India holds the presidency for the year 2023. G20 is basically a group of 19 countries and 19 countries coming together to work for the welfare of the working class group. The theme for this year is Vasudhaiva Kutumbakam, that is one earth, one family, and one future. The first summit held in February in Jodhpur. There are a few, these are the following main concepts that were discussed, that is addressing the global skill gaps, that is imbalances between the skills and the qualification in the labor market, sustainable financial of social security. This was discussed during the session, and it was highlighted as a current and emerging challenges in social protection. So G20 is a powerful reminder of our shared humanity and the importance of working together to build a better future for all. It also underlines that solution to the labor and employment challenges we face today must be inclusive, sustainable, and equitable for all. So these are the different organizations working for Ministry of Health in India. There are also autonomous bodies, that is ESI and EPFO, Employee Provident Fund Organization. So these are the different portals and the schemes available under Ministry of Labor and Labor, that is Shram Suvidha portal, in order to bring transparency and accountability in enforcement of labor laws and ease the complexity of complaints. Ministry of Labor and Employment has launched a unified web portal catering to four major organizations under Ministry of Labor, that is Office of Chief Labor Commissioner, Director General of Mine Safety, Employees Provident Fund Organization, Employee State Insurance Corporation. So this portal enables all the employees across India to register online and avail the services and the benefits that are available. The portal is multilingual, catering to 11 languages. So coming to violence against healthcare workers, what are all the schemes or the acts that we have to protect ourselves, the healthcare workers? One is the Indian Penal Code. The IPC contains provisions that make it criminal offense to assault, intimidate, or use force against any person, including healthcare professionals in the workplace. The Medical Protection Act 2018 makes it a non-violable offense to assault a doctor or any other healthcare professional in the discharge of their duty. The law also provides for a maximum imprisonment of 10 years and a fine. The Clinical Establishment Act 2010. This law requires all clinical establishment, including hospitals, clinics, and diagnostic centers, to provide a safe and secure environment for healthcare professionals. The law mandates that clinical establishment report any incident of violence against healthcare professionals to the appropriate authorities. The Guidelines for Safety and Security of Healthcare Worker 2021. The Ministry of Health and Family Welfare issued these guidelines to provide a framework for addressing violence against healthcare professionals. The guidelines require all healthcare establishments to implement measures such as providing security personnel, installing CCTV cameras, and conducting regular training programs for healthcare professionals. So what are the role of family physicians in this regard, in safety and health at work? So we family physicians play a different role, not just the physician, but also the counselor and the health promoters and educators. And also one of the role played by the family physicians is the advocacy. So advocacy is coordinated efforts to defend, promote, or protect something or someone by influencing public policy debate, interacting with influencers, serving as advocate for patient and the community. So community advocacy for public health. How can we do this job? Identify and target wellness needs and the community's role in addressing them. Work with community organizations and local partners. Use your platform to create changes. So public health is not only responsibility of public makers, but also collective responsibility of physicians. We should seek to promote health. We are unique in to speak for the health of public. This means being able to reflect on social determinants of health and promote equity in health. It means working to spread knowledge about health, importance of healthy lifestyle practices, and preventing diseases and disabilities. It also means to serving as an example in our communities. What are the medical measures that are possible in our practices to help and reduce this any work-related issues? That is pre-placement examinations, periodical medical examinations, medical and healthcare services at the facility, suspected case of occupational diseases, notification, that is national law and regulation require the notification of any occupation related diseases. There are about 22 named and registered occupational diseases which are notifiable. Thank you. So safety at health and work is not just about the environment, it also includes the overall health of the employees and frequent auditing and proper precautions and regular training which is required. Thank you.
Thank you very much, Dr. Supritha. That was very elaborate and very interesting to know the legislations in India and to know about the e-Sharm, the online portal, and actually the whole advocacy that we can do as family physicians. So should we do we have any questions for Dr. Supritha, or shall we go on to the next speaker?
Yeah, we will have that question later.
Okay.
Keep on posting on the chat box and keep it, and we will after all the speakers will take it. Yeah, thank you.
Okay, that's great. So our next speaker is Dr. Asitha from Sri Lanka, also a dear colleague of mine. Let me introduce him. He is a part-time general practitioner and also a medical officer of health in Kakirawa area. He is an FM 360 coordinator of Spice Route and a council member of College of GPs Sri Lanka. Over to you, Dr. Asitha.
Thank you very much, Shami. Thanks for nice introduction. Hope you all can see me and hear me.
Yes, you are video. Okay.
Right. Good evening, all. So the Sri Lankan perspective, I'm going to present to you about the safety and health at work, and commemorating the World Day on this 28th April. We'll go forward. So this is how the Sri Lankan setup works. We have the Ministry of Health, and the Ministry of Health has a unit called Environment and Occupational Health Unit. We call it EOH unit. And also we have a National Institute of Occupational Safety and Health that is stipulated under Act in Parliament. It is called also NEOSH. And we have Ministry of Labor and Foreign Employment. Under that we have a Department of Labor. And under Department of Labor, we have a district factory inspecting engineers, officers, around 25 districts in Sri Lanka. We have 25 districts in Sri Lanka. And at each and every industry or factory or workplace, mostly we tell them to appoint safety officers to work for workers' safety and also the environment health. So it is the responsibility of all employees and also the employers to act for safety and health at work. And these two are the main two acts that work in Sri Lanka: Occupational Safety and Health Act number 28 of 2005. And under that act, we have the National Institute of Safety and Health. And also there is another act called Factories Ordinance number 45 of 1942. Under this factory ordinance, we have all the factory inspecting engineers. So there are a few other legal provisions in Sri Lanka. The National Occupational Safety and Health Policy of 2013. So with that, we provide many policy changes and also the improvements in environment of workplaces, and also the new changes are being adopted. And there's another act called the Shop and Office Employees Regulation and Remuneration Act in 1954. So that helps to define the work time, the rest time, and also the maternity leaves and the medical leaves and all that of shop employees and workplaces. And also we have another act called Mines and Minerals Act of 1992. And under that act, we have stipulated another board called Mines Safety Advisory Board. So they give all the safety guidelines about mining and getting minerals. So occupational safety, the health requires the fulfillment of both physical and psychological health needs of the employees continuously. So that has to be looked after and it should be followed up. So that's how it works in many organizations in Sri Lanka. So workplace safety and health matters because it increases productivity and also in long run, it gives health to employees without losing them. So the government doesn't have to look after the disabled people all the time. Medical officers of health, that is my arena. I work in the government as a MOH. So I look after the safety and health of my population, that is 67,000 in my area where I work, in a remote area in Sri Lanka. And under medical officer of health, there are public health inspectors. We call them PHIs. The public officers inspectors are armed and they are given power under these acts to act and work for the health of people in workplaces if there are violations or any other matters that arise. And annually we get trade license from various traders. So when we get the trade license, public health inspectors they go and inspect and they report if there are any other issues about the workplace safety and health. So they can act under their legislative powers and correct the situations. These are the public health inspectors, the proud category in health sector of Sri Lanka. They have many roles. They control contagious diseases, they control non-communicable diseases, and they look after public health in their population. So they get complaints from public, they get complaints from workers, they get complaints from some organizations, so they act then and there. There are people who are going to the magistrate courts and they file cases and they come up with various remedies to correct the issues. So the workplace health is well looked after in all the medical officers of health areas in Sri Lanka. This NIOSH, or it's a paid service, that is National Institute of Safety and Health. It is a paid service and they play advocacy role, research role, training role, and they give technical support. So that's a profit gaining venture. It is semi-government, this is private and government both, and it is working closely with Ministry of Health, Environment and Occupational Health Unit. And under the Department of Labor, we have these factory inspecting engineers. There are 25 districts, so all the 25 districts are covered. These factory inspecting engineers have legislative power under the factory ordinance. So they will look after all the factories and industries, the manufacturing places, construction places, and the garment factories in Sri Lanka, where we give a lot of energy to the our income and our economy. Because a lot of workers, mainly female workers, they work in the garment factories, and the garment factories are sometimes running 24 hours, sometimes more than 12 hours. So the working environment and the health has a lot of issues. The safety officers are appointed to each and every industry or main factories. They will look after the health and environment, but they will also have support of all other groups, including the Medical Officer of Health, PHI, and Ministry of Health, Ministry of Labor and Foreign Employment, and also the Department of Labor. This is the pictures I gathered from the website of NIOSH, that they are looking after these sections. They will look after the environment as well. All the pollutants will be identified. They will give support to identify the issues. If there are pollutants in the air emission tests, and also the noise control levels. They will look after all the aspects of environmental health and occupational health in industries. The main role of district factory inspecting engineer is to investigate deaths and fatal accidents, and also to act forward, not to prevent them in the future. And prevention of occupational hazards is also a continuous work that comes under district factory inspecting engineer. Investigating complaints by trade unions and workers. There are a lot of complaints that the workplaces are not nice, not soothing, and not conducive for working. So they will act then and there, and they will also look after the factory ordinance, and if there are violations, they will go to courts and they will take action to correct them. And also another role is to conduct awareness programs for employers and employees on safety and health, and instructing on welfare, safety, and to protection. They will do a lot of work. So according to 2019, there was a statistics and research data of International Labour Organization statistic data. Sri Lanka recorded 3,140 occupational injuries in 2019, resulting in fatal injury rate of 0.7 per 100,000 workers, and non-fatal injury rate of 1,390 per 100,000 workers. The main sector with high injury rate were manufacturing, construction, agriculture, forestry, and fishing. So as the earlier speaker, Dr. Supritha said, our penal code and other legislation in Sri Lanka are also acting to protect sexual harassment and violence against workers, as they are all civil people in Sri Lanka. Thank you very much. And that is the overall summary about Sri Lankan perspective of environment and working health. The psychological health is also looked after, but many arenas are still developing, I should say, because there are some bottlenecks and there are some attitude issues of officers. So we are working in harmony with all the groups to improve and make it safe for all workers. Thank you very much.
Thank you, Dr. Asitha. That was very interesting and elaborate as well to know what's happening in Sri Lanka. So let's move on to our final speaker for today. So we have our next speaker is Dr. Fauzia Akhtar. She's from Pakistan. Dr. Fauzia is a consultant family physician working as a family physician for more than 20 years. She's also actively involved in postgraduate and undergraduate level training. Welcome. I warmly welcome Dr. Fauzia to share her presentation.
Thank you very much. First, good evening, everyone. I would like to thank the Spice Route team for inviting me on this important day to talk about a topic which is not very much addressed in our family medicine thing. And before starting my presentation, I would like to say, why is it important for family physician to know about the occupational health? Because the family physician is not only dealing with the problems with the disease or diagnosing a problem, but our main component is also prevention. And this is also one of the preventive part of family medicine to provide occupational health. So before coming on to the role of family physician in providing safety and health at work, first of all, I would like to define what is a healthy workplace. So according to WHO, a healthy workplace provides physical, psychological, social, and organizational conditions that protect and promote the health and safety of all workers of a company. So basically, it's not only the physical health, but as other speakers also talked about, that it is a it also concerns about the psychological health, the social health, and also the organizational conditions also matter. And how, as a family medicine, as a family physician, we can help in this, we'll look just after a few slides. So why is it important? This is important for the employer because it improves health and well-being of the employee, and which itself improves the productivity of the employees, increases job satisfaction, improves the image of the company or the corporate where the employees are working. It improves the morale of the employees. It lowers the absenteeism rate, lowers turnover rate, lowers workers' compensation premium, which the companies have to pay if the patient suffers from any occupational illnesses, and also increases the resilience of the employees to cope up in the difficult environment. Now, here comes the role of family physicians. Why family physician and what are the roles? Basically, family physicians are commonly requested by the corporate industries to offer employee health services at the workplace or in the clinician's office. And these services includes two domains. Number one is medical screening and the other one is medical surveillance. So what is the difference between screening and surveillance? Basically, these two terms are interchangeably used, but screening is just a part of the surveillance. Surveillance is the thing which covers almost all the things, and screening is just one of the domain of surveillance. So screening helps in early diagnosis and treatment of the individual and thus has a clinical focus only, whereas the surveillance has a purpose to detect and eliminate the underlying causes such as hazards or exposure of any discovered trends, and thus helps in prevention. Now, what are the components of medical surveillance? If you see all the components of medical surveillance, so this can all be done by a family physician. Number one is identification of the group of workers for which surveillance or screening activities will be appropriate. Then an initial medical examination, which is also called a pre-employment examination, which is important that if a person is getting an employment for a particular job, is the person or the employee fit for that job or not? Then periodic medical examination at regular scheduled intervals, including specific medical screening tests when warranted. So basically, every job has a different exposures, different hazards. So for these jobs, there are defined guidelines by Occupational Safety and Health Act, and they have a standard guide. They have identified certain hazards, certain chemicals, and they have recommended how frequent the periodic examination should be done and what should be the part of that periodic examination. Then we can also do more frequent and detailed medical examination if we find something on initial pre-medical examination or on periodic medical examination. Now, the fifth component of medical surveillance is post-incidental examination. Suppose if any incident happens, then the examination to identify the hazards which was not previously identified, or if there was some exposure was increased, so we have to identify that. Then we have to do data analysis to evaluate collected information for surveillance and for screening purposes, and this should be notified to the to the company, to the employer, to the employers, and also to the legislation bodies. Then training of the workers is also very important, that when the workers are going to be engaged in some particular work where there's some hazards, they should be trained that how they can prevent themselves from those exposures. Then a written report of medical findings which should be submitted to the employer, and the employer action in response to the identification of potential hazard and risk to health should also be followed by a family physician. And these are all components of medical surveillance which can be done by a family physician. Now, we come to, as we talk, that occupational health is basically preventive health. So the level of prevention, as we see for all other diseases, there are three levels of prevention: primary prevention, secondary prevention, and tertiary prevention. For occupational health, we also have primary prevention, which consists of safety policies or basically the organizational measures and the personal protective equipment. So these are the prevention at the primary level, and which gives you a healthy worker. Then a secondary prevention, basically, if there's a likely chance of disease, then how can we reduce the impact of the disease? Then early detection and screening of any disease which can occur is a part of secondary prevention, and personal protective equipment and educating the employees also part of the secondary prevention. And the tertiary prevention occurs when the patient has suffered from any illness, occupational related illness, then the treatment, the education of the patient, the exposure control, and the rehabilitation, and when can the employer or the patient return to work is the part of tertiary prevention, and this all domains is covered by a family physician. So when we talk about the controls of hazards, so this is the hierarchy of controls. Personal protective equipment is least effective in the hierarchy of controls. So as we go up, the administrative controls, when they come in, it becomes more effective than the engineering controls, like we isolate people from the hazard. Then if this hazard can be substituted, or the last is if they can eliminate the hazard, which is a bit difficult thing in some job and some occupation. But as we move higher, we get a better control of the hazards and a healthy and safe employee. Then after the role of family physician, I'll briefly touch upon what is the current situation in Pakistan regarding the occupational safety. So in Pakistan, we have standards which are based on regulation provided by Department of Labor and Employment, and these regulations command the implementation of practices to establish a healthy and safe working environment. There's a central guideline based on occupational safety and health problems in Chapter 3 of the Factories Act, which was published in 1934. And the Factories Act 1934 also includes the hazardous occupational rules, which was published in 1963. And lately, we have a Pakistan Occupational Health and Safety Act 2018. But unfortunately, we have all these on papers, but they are not really followed religiously in all of the institutions. There are institutions or the organizations who do follow these things, but they are not followed because, and we'll discuss why they are not followed. So the key areas of decent work deficit in Pakistan is poor occupational safety and health at the workplace. And most of the enterprises are not aware of the risk and hazard, and they often do not see the importance and urgency of addressing them. And unfortunately, there's an absence of autonomous regulations concerning occupational health and safety problems in Pakistan. And it is certain that accidents happen at the workplace, but are not getting reported. So basically, the reporting mechanism is also very poor. And the cases of accidents and deaths due to absence of occupational safety and health laws are not disclosed in order to protect the reputation of the certain workplaces. So basically, the employees are compensated, and this has not been reported to the governing bodies. So our recommendation at our level is that policies at national level should be reviewed and implemented. Awareness should be created among the labor force regarding their rights. An effective incident reporting system should be in place. And lastly, the organization that disregard the rules should be held accountable. So these are the recommendations, and I would like to end my presentation with the quote that each one of us can make a difference. Together, we can make change. I know it's very difficult for a particular person or a doctor to bring a lot of change, but we have to do our bit and see how it works and how we can make a change and a difference later on. Thank you.
Thank you very much, Dr. Fauzia. Even in Sri Lanka, most of the patients are not aware that, what they can compensate for, or what they can, or even the safety gears that they are supposed to use, in industry. So I think we all need, as family physician, we can improve awareness amongst workers. That's a role we can do. So do we have any questions from any of the participants? Anyone wishes to?
I mean, can you remember when it was COVID spreading in Europe in the very beginning in 2020 and 21? Many doctors and nurses were crying on television and maybe many of the electronic media. Then they were telling that they don't have enough personal protective equipments, and they were losing, or they were like giving up their jobs. So we can have experience in the recent past about occupational health and hazard. So it is
That's
not
very true.
It's coming.
That's
It's
very true. I think all of us have actually gone through that situation when we were told there are no PPs, at the hospital is running short of those.
Yes.
So yes.
And another thing that Mahatma Gandhi told, that if you want to make a change, that change first yourself. You can start from yourself. So I thought of doing my half, because I have 3 employees under me, my private practice, and even under me in the government sector, there are 40 people. So I should make environment free for them. Like it should be healthy, it should be conducive, and it should be like non-torturing, or it should not like let them suffer or any other matter. So I should make my change. I can make the change.
Yes, that's correct.
So
And I think
would
all
like
of us
to,
are gathered here. Yes.
Yeah.
Yes.
So
please.
I would like to add that those family physicians who are engaged in teaching, so basically occupational health and safety is also a domain of family medicine. So this should be incorporated in in undergraduate or postgraduate teaching. This should be a part, a module, or there should be something in the curriculum which should be added, so that our family physicians are well aware of providing the occupational health and safety to sometimes we know that we have to do, but we have lack of knowledge. We don't know how to provide the occupational health and safety. So I think now the family medicine curriculum, wherever it is being taught, it should include a domain of occupational health and safety, and which is very important. And we have seen in the past major accidents in our company because of lack of safety and the problems. And also COVID-19 has taught us many lessons. So this is a recent past that we have learned many things from COVID-19. So now this occupational health and safety should be the part of the curriculum of both undergraduate and postgraduate teaching of family physicians.
Also, I'd like to add, other than being advocates for promoting the health and prevention prevention of any hazards and in workplace, it is also a responsibility to understand and know about national schemes and the acts laws available, so that we can educate our labor class people, especially who are underprivileged, because many of them are not aware of many of the facilities or the schemes that are available and the benefits that are available under those schemes. So if we know and we are aware of those schemes and the benefits, then only we can talk and tell about those benefits to them. Otherwise, there are many people who go without completing their treatment or without availing the medical facilities for the financial crisis. But those are covered under many of the national schemes. So we should be aware and we should know about those benefits, which we can educate our patients as well. And also this specific chapter, occupational health and occupational hazard, it is involved and included in preventive and social medicine SPM subject, which is in 3rd year, but we usually not focus or give much importance to that. So at community level, it is important for us to know the neighboring industries or the factories or the group of working people where we do conduct camps and create awareness by even by giving a small lecture once in a way to create the awareness.
Yes. True.
How about programs in schools, like the school leavers, educating them on what they're, what they should know about occupational hazards? Because we have a lot of school leavers who, join all these mechanic garages, especially since I'm working in the eye hospital, and they come with injuries to the eye. They have no idea, that they should wear, eye, gears or helmets while they're working in those, the mechanic shops. So that would also be helpful, I feel.
Either they are not provided with the protective equipment,
Or they don't know. Yeah.
They don't. Yes.
And also maybe we can utilize even the smallest opportunity whenever we come across or meet these children or any employees who are working in different setups, to educate them, even just 2 minutes or 5 minutes of brief detail about how they can protect themselves, or what is must and what are the do's and don'ts. Like when we go to repair a vehicle or when we meet in some shop or anywhere, we should utilize each and every opportunity to educate the people wherever possible.
That's correct. So Gobit, are you there? So do we have any more questions?
We all have experience because as general practitioners, I come across there's a garment factory nearby where I work, and all the workers, the ladies were not given backrest. They just have only a bench to sit and use their machine. The garment factory. So most of them are coming with back pains. So I fought with the management to give them a good share that they can lean and have a rest when they are tired. And that worked, but in Colombo and many urban areas, the garment factories, they have good facilities for the workers, but in remote areas, they don't have much facilities. So we can increase all these aspects.
Yeah, at our each one of us at our level can do some improvement. That's what the take-home message is. So on behalf of Strike Truth Young Doctors Movement South Asia, I thank all the speakers who have been kind enough to take time out of their busy schedule to share their knowledge and insights with us. And I'm sure we have all learned something valuable today. I also thank all the participants for being present today to commemorate the World Safety and Health Day. So this brings us to the end of the session. I once again thank Dr. Zainab and Dr. Gobit for being here today and for initiating this very special event on this day. And thank you. Thank you. So this brings the end of the session, and I hope we all meet once again for another session and have another good talk about it too.
Thank you.
Thank you, everyone. Thank you so much for joining.
Good night.
Thank you.
Good night all.